Most people think that chiropractic care is just about cracking someone's back. Like, you go in, hear a few pops, and boom, you're fixed. Hi, my name's Riley, and I thought so too until I had my internship with a real chiropractor, and I learned it's a lot more than that. So before we start, I think it's really important that we understand what chiropractic care really is. So it's a type of healthcare that focuses on spine, joints, it uses hands-on adjustments to reduce pain, improve movement, and help the body function better together. So now that we understand what chiropractic care is, I'm going to talk about why I got into it. I mean, I've always been pretty athletic as a kid, and I've always been really interested in how the body works. But something that stood out to me about chiropractic care is that it focuses on natural recovery, and you don't really need any surgery. So I just found that really interesting. So now, where did I have the opportunity to internship at? And that would be Atlas Chiropractic and Wellness Center. It's located in Costa Mesa, and it's a wellness facility focused on sports medicine, physical therapy, and overall health. So, who was my amazing mentor? And that would be Dr. Lou Rice. So here's a picture of me and him right there. And he has a doctorate of chiropractic, and he's the co-founder of Atlas Wellness Center. He holds a degree in human nutrition and biochemistry, and he's actually the official chiropractor for the US Open. And I find that interesting because it shows not only is he a chiropractor, but he also gets along with athletes. And he's one himself. He used to be a former competitive surfer. And a fun fact about him is he actually speaks 3 languages. He's multilingual, so he's fluent in English, Spanish, and French. Next, I'm going to show what I did. I have a few pictures on my next slide that I'm going to give a brief description of what I did, but I also have more pictures on my junior tab. It should be under work experience, but I'll just get into the ones that I thought were the most important. So here on the right, I was doing cold laser therapy to this patient. This tool that I'm holding to his arm sends in a low level light, and it just focuses on weak muscles, and it heals them faster, so really cool. On the left, I'm doing Pilates, and much harder than it looks, but people come in when they're in the healing process of their injury, and it just helps them work out their core. So another picture I have is me doing an adjustment on their patient. So basically, I told the patient to lay on their back, and I would stretch out their leg, and as far back as it could go. So I learned a lot of adjustments, but this one's the most basic one that I will explain. And here on the left, I did a lot of observing during my time in my internship, and it was really fun watching my mentor work and talk to different people, and I just loved watching him do all the stuff he did. So now I'm going to get into my assessment about ankle sprains, and the reason why I'm choosing ankle sprains is because I sprained my ankle skateboarding, so it was really nice having a chiropractor as my mentor during this time, because I learned a lot. So I'm sure many of the athletes in this room have sprained their ankle before, and they know the feelings of pain, swelling, and injury that comes with it. What I bet you didn't know is that the ankle sprain is actually the most common sports injury in the world, with 2 million happening annually in the US and 25,000 cases a day, which is a lot. But what people don't know is that it's how you treat it that determines whether the ankle heals correctly or not. So it's not just about resting, it's about movement, strength, and stability. So now I'm going to get into my most important step. The first one is determining the severity. So there's 3 grades, and basically what a grade is how bad the ligament is torn. So a grade 1 slight stretching, and a grade 2 is a partial tear, and grade 3 is a complete tear down the middle. And basically there's a lot of instability. You're not going to be able to walk on it at all. But chiropractors look for bruising, swelling, and tenderness, and this basically sets up the whole process of how they're going to heal the ankle, because a grade 1 ankle sprain doesn't need the same process as a grade 3. So the second step, after you know what kind of sprain it is, we have to reduce inflammation. So rest is absolutely necessary, but once again, it's not the only thing you can do. Ice for swelling is important. You usually want to ice for 15 to 20 minutes at a time, and compression wraps are also really important to stop swelling, and elevation so there's no fluid buildup. So you're going to want to lay on your back and elevate your leg above your heart when laying down, and that just makes it so there's no fluid buildup and you heal faster overall. So next, restore range of motion. Stiffness is common, especially after you haven't moved your ankle, so introducing controlled movements are good. You can do movements like ankle rolls, dorsiflexion where you lift your ankle up, and plantar flexion where you move your ankle down. And you want to make sure you exercise slow, because if you do it too fast, you might hurt yourself, and that's what we're going to try to avoid. Because if you hurt yourself, the whole process will take longer. But this step is really important just to heal ligaments. So step 4 is strengthening the ankle, and weak muscles risk re-injury, and that's what we're trying to avoid, like I said before. So ways to strengthen is resistance bands. You can do heel raises for calves because your calf is connected to your ankle, so by standing up and doing heel raises, you're actually strengthening your ankle and your calf at the same time. You want to make sure you exercise slowly with control, like I said before. So next is balance training, and this is my most favorite step, to be honest, because I just think it's the most fun. But injury affects proprioception, and you're probably like, what the heck is proprioception? But basically what that is your body's ability to know where it's at. So if you hurt your ankle, it might be hard for you to walk and you might be unbalanced. So ways to challenge this is by having a foam pad. You can balance on it with your hurt foot and have your healthy leg up and just try to balance. And if you can do it, you're probably on the track for the healing. So next, it helps your body heal quickly and just improves stability. So some exercises you can do is heel to toe walks, balance on an unstable surface like I said, balance on one leg, and some single leg squats, but those are kind of hard. So next is sport-specific training. So this happens when you're going back into your sport after you got injured. So you want to start with like jogging and jumping drills to see if you can move around good, controlled movement at a safe pace, because if you're going fast with your team, you might risk hurting yourself again, and once again, that's not what we want. So this is just a gradual return back into your sport. But one thing that I always recommend is ankle support. So I'm sure if you sprained your ankle before, you've had it taped. And what would you even need for an ankle taping? Well, I'm going to tell you. You're going to want to have pre-wrap, tape, and of course a foot. Now, during this part of my presentation, I would ask one of the judges or one of the audience members if they would like to come up so I can tape their ankle for a demonstration. But obviously, I don't have a foot to wrap right now, so we're going to skip over this, but this is what I would do. Here are my steps. So even after ankle heals, strengthening, flexibility, and stability are all really important steps to make sure this doesn't happen again. But the last step is prevention. How do we for sure prevent this from happening? Because if you hurt yourself again on the same foot, it will probably take harder and much longer to heal since you already hurt it before. So proper warm-ups are good, things like squatting, lunging, and jumping jacks. You're going to want supportive footwear like shoes that cover your ankle, I always recommend, and just have continued exercises. So now we're going to do a case study, and this is basically a game, so I'm going to go over my grade slide again because I'm sure you guys remember, but I just want to make sure we're all on the same page. So there's 3 grades of sprain. There's grade 1, grade 2, and grade 3, and grade 1 is the most mild of sprain, while grade 3 is the worst. So if you can see here, a ligament looks like that. That's a healthy ligament. Grade 1 has a few tears, grade 2 has a halfway tear, and grade 3 is all the way tear through. So we have 3 patients today, and you're gonna guess what kind of grade that has. So this is Caden, he's 16, he was playing lacrosse, and he has an ankle sprain. So from this, can you guess what kind of grade that is? Good, that's grade 2. Our next patient is John White, he's 52 years old, he was hiking, and he has an ankle sprain. So can you guess what kind of grade it is from this? That is a grade 3. And our last patient, her name's Caitlin, she was dancing, and of course, she has an ankle sprain, so from this picture, can you guess what kind of grade that is? That is a grade 1. So good job, you figured it out, and this is really important stuff for chiropractors, like I mentioned before, because if you know what kind of grade they have, you know the process to heal. So now I'm going to get into some of the skills that I gained during my internship. I gained communication skills with patients. Just by watching my mentor talk to other people, I feel like I can talk to people more effectively now. I learned professional behavior in a healthcare setting and understanding patient care and patient experience. It was interesting seeing people come into the office for different reasons, like someone's neck was not right because of a car crash and another person came in for just falling off their bike. So it was a variety of people that I got to talk to. So here's my career reflection. This definitely strengthened my interest in the healthcare field, and I gained insight into the chiropractic career path. I got to talk to other interns that were there as well. They were much older than me in college, but I gained so much knowledge, and this is something that I actually want to do, and this definitely clarified future career interests for me. So if you were to ask me, would I pursue this career? I would say 100 times over, yes. I had so much fun doing this internship, and I feel like I learned so much valuable information, and this is something I'd really want to pursue in my future. So in conclusion, thank you so much for listening to my presentation. I hope you learned so much about me, chiropractic care, and ankle sprains. And if you ever do get an ankle sprain, you know what to do and you know what to call. Thank you so much.